Our joints help us for easy mobility. What do you think, doctor?
Yes. So for the easy mobility of the joint, when we consider the prime joint that we consider for the mobility is the synovial joints. We have numerous number of synovial joints in our body. So as the name suggests, a joint to be synovial, it should have the basic thing that is a synovial cavity. So in order to preserve that joint, in order to maintain the health of a synovial joint, you need some additional stabilizing structures like articular cartilage, supporting ligaments, strong muscles around the joint. So these are the supporting factors which help to maintain the health of a particular joint. So in Ayurveda, what we correlate a joint is Sandhi. So under the Sandhi, there are Chala and Achala Sandhis. That means movable and immovable joints. That's what we correlate. So in order to preserve the health of the synovial joints or the Chala Sandhi, which we can correlate, we use multiple treatment modalities. So basically, first of all, the prime thing is for example, if a joint is a weight bearing joint, the concentration should be will be weight maintenance, so that there will not be any particular load over the weight bearing joints. And similarly, strengthening the supporting muscles, strengthening the articular cartilage, the ligaments, strengthening exercises, and in an incorporated way we have to manage.
Okay.
That's what we intend to do in Ayurvedic aspect.
Okay. Doctor, would you like to add something?
Yes, as doctor said, in Siddha system also we have some special techniques for strengthening our joints and all things, because the main our body is made up of most of bones, muscles and cartilages and all things, so we must take care them properly. In Siddha system also we are doing some special things for take care of that type of joints and all things. So we usually use some we usually use some food and some specific methods to correct this type of.
Doctor, would you like to add something?
Yeah, sure. In Siddha system also, we usually strengthen the muscles, nerves and tendons and all things for the support of the joints. So we usually take care of our diet and our exercise and all the other activities we want to take care. As doctor said, we must reduce our weight first. Then we follow some specific diet in Siddha system. So we usually use some rich nutritious foods for the benefit of our joints. And we do some special exercise and some yoga and some special therapies for this joint health. And we usually do some oil bath weekly once. It will rejuvenate our joints, particularly the main weight bearing joints. It will act more easily after doing this type of oil therapy. Not oil therapy, we can do it from our house itself. So we can weekly once you just apply that oil full body, then take a hot water bath, then it will help you definitely. Your bone and your muscles and your all other structures will better, and you will get strength for the future purpose.
Okay. In an Ayurvedic point of view, what type of medication and treatment do you?
Yeah, I would like to justify a point that doctor has already told regarding the application of oil. See, in Ayurvedic point of view, bone is correlated with Asti Dhatu.
Okay.
In that, we have a principle called as Tridosha, Vata, Pitta and Kapha. And Asti Dhatu is considered as the abode for Vata dosha. Okay. So when as the person start to age, during senile period, the Vata dosha is considered to increase.
Okay.
So it is like when the Vata dosha start to increase, it will start to deteriorate the Asti Dhatu.
Okay.
So according to the Ayurvedic perspective, if you observe that senile people are more prone for bone diseases,
right,
like osteoporosis or bone degenerative diseases. So I would like to emphasize this particular point with an example. Now see, you have a very dry twig or a stick with you.
Okay.
If you just bend it, it will break suddenly.
Right.
You keep this twig in a glass of oil for about 1 week, and you take it out and you try to break it. It won't break. It will start to bend.
Yes.
So the tensile strength of that particular twig or dry bone, dry twig is increased.
Yes.
The same principle we can apply in case of Siddha.
Okay.
So when you apply this oil, when you take this oil or the medicated ghee or the prescribed medicines that we use, it will increase the tensile strength of the bone. So because for a joint to happen, the prime constituent is two bones. When two bones come together, or two or more bones come together, then that is considered as a joint. Right. So the prime constituent for a joint is a bone.
Yeah.
So a healthy bone leads to a healthy joint.
Right.
So the prime thing. So the supporting structures are secondary. Yeah. The ligaments, the muscles, whatever it is, the cartilage, all those are secondary. So first of all, you need a healthy bone to have a healthy joint. So that's how we manage.
Can you recommend some Ayurvedic internal medications for this?
Yeah, definitely. Yes, in case of osteoarthritis, which is quite a common condition that is seen in senile people, we can use Maharasnadi Kashaya.
Okay.
It is having a very nourishing mode of action over the joints. Apart from that, it also helps in the relief of the pain. So that is it is like a broad spectrum antibiotic. I know it's not a proper term to use, but still, in Ayurvedic perspective, Maharasnadi Kashayam is something that we use for a broad spectrum. Okay, a lot of conditions can be compiled under this particular Kashayam. Right. So that is one thing that we can use for bone conditions, bone disorders. Right. Then Kaishora Guglu, then we have Kogilakshadi Kashayam. These can be used for conditions like gouty arthritis. Okay. You know, when gouty arthritis is the condition when there is an increased amount of urate crystals in your bloodstream, which start to deposit in the particular sites of your joint, causing severe pain. So in such conditions, we can use these type of medicaments. Okay.
As doctor said, the Vada is the main reason for this type, because it is the movements of our joints. So the proper the stability of Vada is the main reason to move our all joints. So you must take care of the Vada dosha in its correct ratio. I mean, Tridosha theory, Vada, Pitta, Kapha. In Vada, it must be in the proper ratio. Then only we can move our joints freely, like that. So any interference in this Vada, it will derange due to some foods and some other activities, day-to-day life activities, maybe work related, or some other external cold exposure, like that. But due to this, our Vada may be deranged. So for normalizing the Vada, and all our joint may become dry. Due to this increased Vada will cause the dryness of this joint. Sometimes it causes the increase in Kapha also. So some inflammations may be there. It also happens in rheumatoid arthritis. In Siddha terms, it will be like that, and the deranged Vada will cause the deranged Kapha. So both are affected. So we usually give treatment for the both conditions. So in this case also,
the internal medications you would give, you can name some.
Yeah, we usually use the internal medicines for this deranged Vada and deranged Kapha. So as I told that deranged Vada causes the dryness of the joint. So we usually use some oily medicines internally. I mean, Chitramutti, Madakutailam, like medicines for the proper movements of
for lubrication
of that joints, like that. Then we can use probably maybe their pain will be there. So for the pain also we give some medicines, like then Chandamarada Chandura, Veera Chanduram, Rasagandhi, like medicines we can use.
Take care of your bones, move freely and live fully.